Namaste everyone. I am Dr. Manjunatha, Professor of Psychiatry working at NIMANS, Bangalore. Today I come up with a new way of thinking in our history taking and psychiatric bar mental status examination. I am calling mental status examination these days as a psychiatric examination. The idea is something like this. In history taking, we have a section called adequacy and reliability, and we comment on the history which we got from patients and family member, that how much is the adequacy, how much is the reliability, which will help us to make a diagnosis of the patients. And when it comes to mental status examination bar psychiatric examination, we don't have that kind of category. Why can't we just simply have a confidence score of finding of the mental status examination or psychiatric examination? And this will give another dimensions similar to adequacy and reliability of the findings. So in that way, that will be really helpful. And coming to other investigations, none of the investigation 100% perfect, none of the findings even in physical examination, CBS, RA, CNS is 100% perfect. So similarly, finding of MSc is also doesn't have 100% confidence score. So in that way, it will give a edge even for medical legal cases, that this is the diagnosis which we are carrying, the finding which we got is the confidence score is this much. I want all of you to give comment on this section, and this idea is also generated after reading the book. One of the chapters called this mental status examination by David Martin, where he has just given a confidence in second page saying that examiner reaction to the patients. The feeling aroused in the examiner by patients are often source of very useful information. These data are sometimes subtle and easily overlooked as examiner in an attempt to remain objective, and fails to note how he or she is responding to the patients. This is also very important. So confidence score of the finding of mental status examination or psychiatric examination. Please give your comment in the comment section. Thank you very much. Dhanyavada.